Welcome to the Conscious Giver podcast. I'm Tysis Jackson, your Conscious Giver in Chief. And this is a special season of the Conscious Giver podcast. It is all about rural health and health disparities. This is the highlight of the 2021 Giving Guide. And as I shared with you in a previous episode, which if you haven't heard, go back and listen, it was really spurred on about my journey this year. My journey this year was about being a conscious giver every single day. And that's the theme of the Giving Guide is really about how we can be conscious givers every day. And unfortunately, I was forced into it. My mother this year was diagnosed with stage 4 pancreatic cancer. And immediately I made a decision to be her caregiver, along with my sister and her family. And my whole life changed. And while it was the most challenging experience, it was the most beautiful experience. And unfortunately, September 11th, she passed away from pancreatic cancer. And immediately, I just felt like, what am I supposed to do next? And made the decision that I was going to start first with conscious giving, because that's what I know what to do. And I was able to connect with amazing people who really helped me to understand more about the challenges that I saw in their rural Southern Georgia community. I think every episode I'm going to talk about the gentleman who rode his bike, a young man who rode his bike to his cancer treatments, his chemo treatments, because it touched me in such a profound way. Understanding that Georgia is not a part of the expansion, the Medicaid Affordable Care Act, Medicaid expansion, and the limitations that it had for so many in the community, and just really understanding how you can and I can make a difference for so many people who are getting diagnoses, not just cancer, but just many other health conditions that is limiting their lives. And as conscious givers, there's always a way that we can be intentional in our work and make an impact. And one of the experiences I had that was unique to Georgia really had me going about how I can make a difference. You know, I'm originally from Indiana. I live in Washington, D.C. So rural health was very different for me. And I wasn't as familiar with Georgia. I live in this, well, not a state, but we could change that, D.C. statehood. Let me pipe in. But I live in a city that has almost 100% healthcare coverage. And regardless of your status, citizenship status, you are able to have healthcare coverage. Now, while we know it might not mean the appropriate access, it does give you peace of mind, and there are peace when emergencies and healthcare emergencies happen. And so today I'm really excited to talk to Lisa Medellin. Lisa took a random cold phone call from me and just indulged me in sharing my experience of my mother being misdiagnosed, the healthcare system challenges, and the health disparities. And I knew right away that she was someone that really cared. I actually intentionally called her because when I looked at her background, I was like, this is someone has done amazing work for Georgians. Lisa is the Director of Programs for Healthcare Georgia Foundation. She's a member of the executive team and has been making a profound impact from 2005. She's been responsible for leading the vision, execution, and awarding of over $57 million in grants in Georgia, which is a lot of money, and I know has made a really great impact. She's a committed healthcare professional. Prior to joining the foundation, she held senior management positions at Emory University, Rollins College School of Public Health, the American Cancer Society National Home Office, and Planned Parenthood of Southeast. She has a really vast knowledge of Georgia, rural Georgia, their nonprofits, healthcare, And I suspect she's a Midwesterner like myself. She has an MSW from the University of Illinois, Champaign-Urbana, and also did her undergraduate work at Illinois State University. So Lisa, thank you so much for joining me today on the Conscious Giver podcast.
Thank you, Titus. I am so excited and happy to be here with you this afternoon.
Oh, thanks so much. When I first, you did so well. When I first called you, I was talking, I was sharing so much, and you really laid out the mission of the Healthcare Georgia Foundation. Could you share with our listeners today about the foundation and the work that you all do?
Absolutely. And before I do that, I just want to say that one of the reasons you started with, I took a cold call, and interestingly enough, that's kind of what the culture is at the foundation. Like, we try to be open, accessible, and available. And so when people reach out, we do our very best to be responsive. Even if we're not a right fit, we're able to connect you to others. So moved and compelled by your story. And unfortunately, it wasn't surprising to me or very uncommon. And we'll talk more about that. But Healthcare Georgia's Foundation's mission is to enable, improve, and advance the health and well-being of all Georgians. While it is a very simple and direct message, it is quite challenging, to say the least, to accomplish that. It's very aspirational. It aligns with our vision, which is health equity in Georgia, where all people can attain their fullest potential for health and well-being. And so in everything that the foundation does, particularly our programming, our grant making, is attempting to elevate those two concepts and constructs. My role in the foundation, as you mentioned, my official title is Director of Programs. And so that has a broad meaning and deep. We are a relatively small foundations as foundations go. We do about $3.6 to $3.8 million in grant making annually, only in the state of Georgia. We are a privately held foundation, which essentially means that we don't fundraise and we don't bring in money from the state, if you will. Our funds come from private resources that were created as an endowment for what's known in our industry as health conversion foundations that occurred in the late 90s. And so we exist off of the residuals of those investments. It's just a simplistic way to explain it. And essentially, each year our funding allocation can vary, just depends on what's available. And so we have focus areas that we want to address our grant making around. Currently are in the midst of a strategic plan and working diligently to execute some key areas of interest. Some of the things that we have interest in right now are maternal and child health. And in 2022, we will be rolling out some special initiatives around maternal and child health. Anyone in Georgia, we encourage them to go to our website. That's always the best way to find out about funding. Contacting me directly, I'm probably going to tell you to go to the website. So we have a calendar, a schedule in which things come out. The other area that's of interest is behavioral and mental health. And also in 2022, we will be rolling out some funding programs specifically addressing behavioral and mental health needs of African American and Latinx youth. And so we're really excited about that. And it's in the developmental stages at this point. And we're looking forward to 2022 to launch that. Other areas that we've had interest in and will continue to work around is a program we call Direct Services, which is our program supporting chronic disease programming. And so that usually comes out in the late spring of the year, around June, late spring. And so again, go to the website. After the first year, you'll start to see more about that. And then lastly, definitely not least, because it's a program that I have been managing and is part of why we're here today, is a Two Georgias initiative. And so the foundation has been investing in Two Georgias since 2017. The intention was we had heard a lot of information. People were talking to us, telling us that there were a lot of disparities in rural Georgia, and that effectively it amounted to that you'd have two Georgias. You have metropolitan Atlanta, and then when you get outside the metropolitan area, it's vastly different in terms of accesses, resources, services, whatever you can imagine. And so we did some homework, some due diligence, and really investigated what was happening. We did some community forums where we went around 5 regions in the state to hear from people directly about what they saw the challenges and issues, and so that helped frame us developing a funding program, which became Two Georgias Initiative. And currently, that program is in its bridge year, which for us means we will move into 2022 and towards the mid part of 22 exit that strategy as it currently exists. It doesn't mean we will not be interested in rural health. It just means we're going to maybe step back, take a look at what we've learned, what are the lessons, how can we use that, and what should we do next. But right now we have 11 communities that we are funding and supporting, that we have funded through this initiative, who are largely funded with under the space of community health coalitions. That's essentially what they are. Many of them are attached to a lead organization that actually is responsible for the work, if you will, but it's really community coalition work. It's really, I would imagine, grassroots as it's best defined and has been for a long time.
Right, right. I had shared with you that in my role when I was with the American Academy of Pediatrics, the DC chapter, one of my best experience was being a part of a funder, and it was sort of this coalition. And it wasn't just the experience of how we move the needle, because that now when you get to a coalition, that needle, if you have the right lead organization, which we did, and you put it together, you can really move the needle in a profound way. So we saw a lot of great outcomes. But I think the part that for me that was so amazing is the relationships that I built throughout with the other nonprofits, individuals that were involved with the coalition. Because that you know, when you're running a small organization and they're grassroots, you don't have a lot of time. And so it's almost like you're getting paid, because you're getting paid to do this work. You actually start to collaborate and build relationships that you would never have the time to do. So I was really interested, knowing that you're at the tail end of it. What would you say, as you think about the beginning? You talked about, you know, you were hearing about how these disparities in rural Georgia was happening. What were some of the best outcomes that you're seeing as you're wrapping up this strategic focus?
Well, that's still being revealed to us, honestly. But I can tell you what we've learned and the nuggets that we've learned, because part of what we're going to do in this year, starting in January, is we are going to be working with a communications firm who is going to help us actually go into each of these communities and do like a video diary, if you will, talking to members of the community, documenting their story. What were their lessons learned? What were their successes? What do they feel like they could have done better? And package that in a multimedia product at the end of it, at the end of the year, and then release it. But I can tell you what some consistent themes have been. And many of these communities, let me just back up. So for those who may not know Georgia, so Georgia has, unlike, I think it's unusual, probably most states don't, has 159 counties. So we can have a whole nother podcast on that.
I was like, wait a minute, no, that's a lot.
Yeah, it's a lot. And there's some history behind it and all of that. But be that as it is, there is a surveying tool and instrument that many folks in the health space refer to often. It's called the County Health Rankings, which is distributed by Robert Wood Johnson Foundation. They're the funders behind it. But the County Health Rankings has been a really good assessment tool for states to look at how their health status is improving, progressing, or if you will. So what we saw back in 2017 was one of the counties was ranked 159. So if you had that county health rankings, which happens every year, this particular county was ranked 159. They were the lowest in the entire state. They are a shining example of how this county went from that space to, I think last year they were at maybe 155, 56, which is not.
Oh, wow. No. But it's hard. It's
Yeah,
really hard work when you get
right.
to health to move that quickly. That's amazing.
And so I bring that up as an example because there were themes that came out in that community that resonated in some of the others. And so all of them are on a different trajectory.
Right.
Some moved really far and some kind of, are still kind of pacing along. But the things that started to emerge, which was what we saw in the one community that had that big leap in their health outcomes, was the fact that for many of these communities, it was the first time that somebody came to the community and said, we're going to let you decide what you need to do in your community to make it better and healthier. We're not going to tell you what you should do. We're going to let you decide. And that was very profound because we had a centerpiece to this work is health equity and equity. And so what that meant was that we wanted them to bring people to the table to have so that everyone could have a seat at the table and that their voices could be heard. So it didn't matter if you were the school superintendent or you were the local person who worked at the grocery store or a pastor, whatever your space was in your community, you could be invited in to join this coalition and give voice to what you would see needs to happen to make the community better. Some other things that I think really emerged that were consistent themes were having listening sessions. So the community coalitions have regular meetings and those effectively turn into, especially early on, they were listening sessions so that the community could hear and talk to each other because a lot of that wasn't happening. I talked a little bit about equity. We really wanted to narrow in and go in deep on that concept because a lot of times, particularly in health and public health, you hear a lot of dialogue about health and equity. But when it comes to really actualizing it, it can be very challenging because in order to do it, you have to start to unpack a very hard conversation. And in many communities, there's a lot of history that has long history of racism in some communities. These are communities from the rural South from which their lineage goes back to pre-Reconstruction and in slavery. And so there were points where we really leaned in hard by providing them technical assistance around having conversations about race in the community and race equity and what that meant. That was a huge shift and change. That was a consistent thing from all of the communities because they were required to engage in that way. And I know in many of these communities, that was the first time anyone sat down and had a conversation with them about their history of their community, what race has meant, how it's shaped how people engage, who has power in the community. That was another thing, leveling the playing field about what power dynamics mean and how does that play out when you're trying to do community organizing and build community. The last thing I'll say in terms of, because there was so many things, but again, I'm trying to lean in on the themes, the social determinants of health. What we found out very quickly, because the first year of their grant program was a planning year. Well, they didn't have to deliver on anything. They could just spend the year establishing the coalition, creating an organizational structure for the coalition, creating just kind of guidelines, how often they would meet, where they would meet, who would be helping guide the meetings, all of that. And
So
as
good.
things started to evolve, the social determinants of health became very centerpiece. So many of the communities, their work covered some of what we would think about traditional health areas like diabetes or healthy eating and nutrition, but they manifested themselves around some other concepts. So, for example, we're talking about rural communities, and here was a, a learning for me that while many of these communities still have very much agricultural economic systems, it's still very difficult to find fresh fruits and vegetables. And that was like an eye-opening thing for me. I was like
Wait,
so naive.
what, Lisa, I have to tell you, I was so disappointed in the farmers market in my family's town. I'm just like, there are farms
Right.
nearby, because they're so close to Florida. There's all these farms, and the fruit was terrible. I
Yeah.
mean, the fruit that was there, I was like, I'll just go to the grocery store and get my watermelon.
Right.
I,
Yeah.
I was, I mean, it was shocking. I
It
and
is.
I yeah, I'm like, I live in the city. I'd rather just go to get
And I
something from an
think
urban farm.
most people would not know that if you are not from a rural community and know that. And so one of the things that came out of this was there was a disconnect. And so part
Mhm.
of many of the communities work was projects were around how do we connect to the farmers, to the local
Yeah.
farmers, because many of the local farmers would have surplus. That happens a lot. And they had to build a connection on how could they get access to the surplus. So what they
Mhm.
started was what's known as gleaning projects, where volunteers from the community at certain times of the year when they were bringing in harvest would go in and help glean some of the produce, and what they glean they could then take and share with the community. And so
We'll
it's
call
things
that the
like
Ruth Project. We'll get
it's things
biblical.
like
I'm like, oh, that's just Ruth. Oh, that's
it seems
good.
like a very simple thing, but it had not been enacted. And so it was
Wow.
a way for them to start to chip at that issue of we're in an agricultural community, and yet we're not having access to the fresh fruits and vegetables. The other things that emerged around social determinants of health was housing, transportation, and broadband issues. Those
Mm.
three things are, I would say, in all of the communities were consistently challenges. They're still facing some of them and working on some of them because they're
Yeah.
longer systemic kinds of things. But the thing I want to say about the housing, again, I think that was a lot of learning on the foundations end about that, because apparently in many rural communities, there still is a housing shortage, because you have a lot of housing and property that's been abandoned that maybe a family owns the land, or if there's property on the land, but the family has moved away, or many of members of the family are now deceased or elderly and unable to care for it. And so it just sits dilapidated, and nothing is happening with it. And so many of the partnerships started to look at, well, how can we start to work with some of the resources, in terms of the state, whether it's an economic development program where we can start to address the housing. And I will tell you, one of the things that really brought this to light for one community was the teenagers, because they were doing a project, a photo voice project, it's called,
Oh,
and they were
amazing.
capturing videos or photos rather across the community that were to elevate what health looked like in a photographic way. And they came back with photos of the dilapidated houses. And their logic behind that was, to them, that was a health issue, because it was affecting the physical environment. It was affecting their emotional health, because they talk about how it makes them not feel proud of their community, and
Mhm.
that it's a hazard, because, usually bad things are happening around a piece of property that's unattended. And so they wanted to elevate that, to let the others know in the community that this needs to be addressed. And why can't we make a pathway towards addressing whoever owns the property, getting it repurposed or whatever needs to happen, so that it doesn't affect our physical environment. And they talk a lot about how the view of that and seeing that, and what that
Yeah.
did for them psychologically, day after day, to have to drive by these properties that are not being cared for. And so when you ask about that, it's really right now around themes. And there's so many, I mean, so many, I think, things that I would say the other thing around this, what, kind of what came out of this for them was they now have coalitions that are thriving. They are functional. They are now considered a resource for the community. We saw evidence of that while we don't have concrete evaluation proof. But when the pandemic hit, one of the things that they quickly were able to tell me was that because they had an in place, intact coalition that people trusted, that the community knew they could go to, they were able to quickly pivot. And like many communities around the state, able to get food distribution or whatever resource needs, testing, PPE, whatever people needed, because they were already established in the community, and people came to them and said, we have someone wanting to donate this, or they're going to bring this. And they had the connection to the community. They had the trust, and trust is a huge, huge thing in many communities, and in rural communities, that's especially true. Being an outsider sometimes is very difficult, but I think because so many of these coalitions are represented by people who are just everyday people. It's not always just the people who have a position of power, if you will. But and that was, and last I'll say, and that was another thing that we saw that was a huge benefit. Some of them had really good success with bringing in and engaging their local elected officials because, as you know, being that you actually are from and have family from a rural community in Georgia, a lot of what happens to change things doesn't happen at the state capitol here in Atlanta. It happens in somebody's local town and a local county. And in many of these situations, they were able to build relationships with the mayor, build relationships with the county commissioner or their local state representative, and invite them in to here's what we need, here's what we're thinking about, and so that they could work locally on solutions. And so I could go on and on, but
no. Those are amazing examples because I when I think about even from the fact that we were really fortunate, and partially their town is has a small military base, so there is a high insured rate, which leads to having the county hospital, the hospital that's I think I don't know if they're what the next hospital is. It's in Savannah. I don't know if another rural, there's one up in Jessup, has a smaller hospital than the small one that's there, but we actually had a new oncology center when my mom came, and many of the people were from the local community. And what you touched on when I spoke about the young man who had cancer and had to ride his bike, and I couldn't figure out. I was like, okay, there's no Uber or Lyft. I'm thinking like my DC mind. I'm like, how can we do this? And it was so hard. And then one of my mom's good friends. That my mom is like one of those people, she just makes friends, even in the midst of so much pain. Like I knew that she was half, her energy and just personality was half of its normal pace, but she still like made all these friends while she was getting treatments. And one of her friends was doing really well. It was her second time battling cancer. And then she had transportation issues but her daughter lost her housing and moved in with I think it was like 3 kids, and her health just went downhill because she was stressed out. And when you're getting chemotherapy, you really need a space of like peace and healing. Stress is the last thing that you need. And I think that was so keen as you talked about. The teenagers knew that our community and how it looks and how it presents has an environmental and a mental health space. I was just like, oh my gosh, because you could see that in other contexts, but for them to just like pull that out, it's just so perceptive of them. So great. So, one of the things that, I have just really connected with is because my friends that were in DC and Virginia had to deal with parents with long-term care and cancer. And they were giving me like, oh, you should be able to do this. And I'm like, no, we don't have that in Georgia. I mean, like, I like literally, like, they were like, do you have help in the home? And I was like, no, it's not offered. Like we literally were taking care of my mother 24/7 when if I had brought her to DC, I would have had 24/7 support, just because of some of the policy that was changed. And so I was really interested, like one of the things that came out of the rural initiative, because we know that Georgia is one of the 12 states of that did not do the Medicaid expansion. Did anyone sort of hone in and talk about some of the policy issues that were they thinking about policy or advocacy as something that they were considering to do an outcome for, to kind of improve the health outcomes for their community?
I think that started to evolve. I think in the beginning, there was much more emphasis on programming kind of activities, because there was such a demand and a need for certain things.
Yeah.
I think as the years have passed, they've started to see that some of the issues that they have in a community really have to have a policy agenda. You won't get very far with that. I think they're learning now, and part of what we've been providing them with is some technical assistance with some folks that we work with to help them better understand how do you go about that. It's a little different strategy. And that you can start with local policy. It doesn't have to be changing a state law.
Right.
There's things locally that can be done. So I do feel like they have now started to understand that. Economic development seems to crop up quite a bit because many of these communities are fairly economically depressed. A lot of the industries there have dried up, if you will, or have been struggling, and the pandemic only made that worse. And so you see and hear about some that are trying to work with their local chamber of commerce, or in one situation, essentially the Chamber of Commerce had been dormant, like it existed, but it wasn't doing anything. And so through the work of the folks on the coalition, they were able to kind of re-engage that group and say, hey, let's look at what we have here. What can we do? I think some of that has also emerged as they started to see value in the assets. One of the things that I've always, as a philanthropist and practitioner of this work, is I'm always asking my team and the foundation, and even in other networks, what are the assets? Because I fundamentally believe, I don't care where you are, what space you're in, every community has assets. Even if it's just you have one individual that's willing to commit some time and effort and do something. If that's all you can see in the beginning, then okay, let's go with that.
Yeah.
I think even if that's all you think that you have, you work with that. And when you work from an asset base, I think it helps build the self-esteem of a community. And I think that's something that has evolved, that communities have esteem, if you will. I know we often hear that concept around an individual, but if you imagine that you're living in a community that's very economically depressed, it doesn't seem like people have opportunities, or there's always negative things about the community being on the news or the media, it starts to affect how you feel about where you live and where you call home. And so I think as they have started to realize and recognize they have a lot of assets, it's given them, to be empowered, if you will.
Yeah, that's the word I was thinking about. Exactly.
To feel like, well, wait a minute, we can do this. We can figure this out. And I think what we're starting to see is that policy kind of mindset starting to really, really emerge, because as they're in a bridge year, and the fact of the matter is our funding will be ending next year. And so they're preparing. We're helping them be prepared. Our foundation doesn't make a practice of starting initiatives and leaving communities on the hook. So we've been working with them for almost a year on sustainability and planning.
Yeah.
Many of them have come forth with very thoughtful, well thought out sustainability plans. They've established and identified partners. Some of the other healthcare leaders in the community have stepped up and said, well, you all can come and have a home here now, and we'll find resources to help support you. Many have been able to write grants and get additional money, and I've been just blown away by that. I mean, just the fact that they've been able to figure that out. I mean, it's just been amazing. So, yeah.
Oh, and I think it's because the value of the work. Because when I asked the question about taking that policy direction, your explanation was spot on, because it really takes you to reimagine, what what the power structure looks like. And that doesn't happen overnight. And so that's really one of the advantages of having a grant, that it gives. I mean, I love that it started with the planning for the year, and it sort of just allowed them to build and have that. So now they're able to, I'm not surprised that they're able to attract more money, because oftentimes, just so in my background of being on the other side of actually fundraising and working with nonprofits, it really does take 3 or 4 years just to sort of get things going and in place, and to sort of recognize the power that you have. And that's really, one of the themes that has come across is that this has been a lot about healthcare. We've talked about healthcare systems, health equity, health disparities, but no one has talked about it in a vacuum. It's all has been really about, a theme is about education. And data shows, like, the more educated, the better healthcare outcomes. But the community and housing and food insecurity are all things that are just really just grown. So this is something that just kind of came to me right now. If you were if someone was watching this or listening to this episode, and they are a conscious giver and they feel really passionate about what they heard you talk about, they're like, I'm from Georgia, I grew up in Georgia, I live in Georgia, I want to do something to help with rural health in Georgia. What would you say? What could they do in order to take what you all have, this intentional work that you have done, and what could they do to translate that to make an impact in rural health in Georgia?
What I would say is get involved. Get involved. It's simple. Show up and be involved. Find out what is happening in your community, where you might be able to add your time, your talent, and your treasure, and how you can do that. And then I would encourage people to think about how they can engage what's right around, what's in front of them. This to me is back to the leadership that's in place. We have elected officials, all of us, and many of us are probably woefully not good with setting time to meet with them or their staff. And in a small rural community, that's probably a lot easier to do than in a larger city like Atlanta, for example. So
Right.
I would say get involved, whatever is there in the community that you're passionate about, find a space and own that. Identify those elected officials that you can sit down and say, hey, let's just talk about how do you see the health in this community? What could we be doing better? Let's figure out how do we partner. Who are the other stakeholders? Talk to them, even the non-traditional stakeholders. I think about the business community and the faith-based groups as well. Oftentimes, we don't think about them when we're looking at if we want to address health issues and health equity. But I think those are people and places who could definitely be engaged. But I don't think it really requires a big thing to do. in order to address what's happening in a rural community. And if you're in a rural community or you're connected to one, just start to have some conversations, find out who's there and who's interested. If you don't have a community health coalition, you can start one. It's not, doesn't require any magic. If it's just a group of people getting together once a month to say, hey, here are some issues that we see, what can we do to start to get around it? If you're here in Georgia, I can tell you that our communities that Healthcare Georgia is funding, the 11, they're not the only ones. There are some other health coalitions that exist as well. The other thing is, think about a regional approach, because one of the things, back to this idea about 159 counties, one of the is that the
Sorry, it's just like, ooh.
I know, yeah. And if you knew the history behind it, it would be further.
Yeah, I can only imagine.
So one of the things about that, though, is I think that the two Georgia communities have realized is that some of those larger issues that have systemic kind of things connected to them. For example, we talked about the issues around broadband and transportation. So they're having to think about regional, because one community is not going to have the financial resources alone to solve that. And so it may be a county region. So many of the communities, you may have one county, but there are 2 or 3 others surrounding them, and they're connected because you may have to drive one county over to where the nearest job is,
Right.
or your kids, the school system may serve 2 counties. So there's some relationship there. And so I think building that up, being a voice for change in your community, and just simply get involved. Find out that space that resonates with you and get involved and see what happens. Mm-hmm.
Yeah, no, that's great. That's great recommendations. And, it is so funny. I didn't even make that connection until I heard you talk about this, because COVID has been broadband is big. It's a utility now. It's a public utility that everyone should have. And one of the projects I'm working on right now with a client is and I'll relate it to Georgia, is Fort Valley State, and allowing them to be able not just to have broadband on their campus and high net broadband, but also the communities that serve as part of their land grant mission. And because they serve, I looked at the data, they are some really poor communities. It's really like overwhelming, but you're right. I'm so glad you made this connection, because I feel like as I walk away from this podcast series, it's almost, I kind of set it in this healthcare place, but it's not necessarily about healthcare, because if you're working on broadband, you're helping with healthcare. If you're doing transportation, all of this interconnectedness is there. And I'm really looking forward to looking at the final report, the visual report that you all are creating in our giving guide. So just to kind of promote this, we do have you all as a resource, because the part that's different that I'm expanding into this year is really for people to learn about the issue and to find the space. And that's why I'm so glad that I was able to have you in this episode, because you really connected those dots for us. And I encourage everyone to visit the website, and everything is linked on the giving guide, and they'll be able to see your work and learn more about it, and really find a place of where they can make an impact with rural health. And regardless of where you live, regardless of where you live. One last question, Lisa, I want to ask you just really quickly. This is sort of like personal and professional, but I just think that I'm just so interested to hear what you have to say. If I gave you the power to make one change on one of the biggest health equity, because I feel like you're on the pulse of that, the maternal health. I'm like, that's my other passion, maternal health, infant health. I'm like, so I gotta kind of keep track of what you all are doing. But what would be something that you would say in terms of what you could change for the biggest issue in health equity in Georgia? What would it be?
And when I pause about that, it feels like a big question, because there's so many tentacles to that.
Mhm.
that concept. But I fundamentally believe that one of the things that could have some very impactful benefit would be addressing implicit bias within the healthcare delivery system. It is one of the things that emerges around every space that the foundation has worked in, whatever the health area is,
Mhm.
if you will, and regardless of the community. So this isn't just a rural issue; it's an urban issue. It's
Mhm.
just an issue. There are a lot of stereotypes that people and attitudes that people have without conscious knowledge. We'll assume who are healthcare providers, unfortunately. And it starts with whether you're the front desk person or the person on the phone scheduling an appointment, all the
Right.
way up until the patient comes to the office, comes for services. And so there's a lot of just implicit bias about different cultures and races and people and when they show up. And that, unfortunately, the healthcare system isn't um, immune to it just because, you're delivering healthcare and your intention would be
Right.
to have health and wellness. That kind of thing permeates all other types of systems in our culture. And so I would say that is the thing that becomes a barrier for people to want to go to get healthcare treatment, want to be consistent with compliance with whatever the treatment is for whatever they're doing, and just
Mhm.
how you feel good about your experience.
Yeah.
Some of what you shared with me around your mom's story and what happened with you and with her and your family, that was one of the things that came to my mind because the concept of implicit bias also kind of spreads across how the healthcare industry treats people of color, particularly women. We're
Mhm.
often, and there's been lots of research on this, um, thought of as being able to withstand pain longer. Sometimes our symptoms are ignored, or we're more likely to be misdiagnosed or not
Mhm.
given follow-up care for specialty care or tests or things that you might want to do, simply because there's a bias about the thought about women of color, particularly Black women, don't feel pain to the same extent as non-Black
Exactly.
people. And that's been documented and proven. It's not
Yeah.
just my
Sickle
brand.
cell emergency. Oh
Yeah,
yeah.
I
It
mean,
is
it's a
it
whole
is
thing.
yeah. 40
Yes,
years of research. It's
and there's
proven. You're right.
another, examples around the maternal and child health. Some of
Right.
what some recent horrific stories around women who were ignored, and they account for socioeconomic status. It doesn't really matter that still and yet you can encounter a negative experience and interaction, and all of that stems from implicit bias and an unconscious stereotyping of women, and particularly Black women, when we enter the healthcare system. And I feel like
Mhm.
that in and of itself is a disease within the system that needs to be eradicated.
That Ooh, I'm like the whole time, you're right, because immediately my mind went to not only, for 4 months, my mom complained about pain and you know, was not like her PA did not like take any action or do any tests. But then when she, had this, what we thought was a stroke, but then they told us diabetes. And literally the day my mom was diagnosed, my neighbor, who's a gastroenterologist, said to me, they just thought she was just a Black woman. I mean, because there's no explanation of,
Yeah, yeah,
I mean, like there's nothing that would say these symptoms and what was going on matches to her having diabetes. And because I'm like, I refuse to believe that anyone's that incompetent. I just refuse.
yeah,
But when she explained it to me, she just said, "Oh, Black people get diabetes. They just thought Black people get diabetes. It's just
right,
diabetes."
right.
And the day before my mom was diagnosed, she had a secondary Medicaid insurance with United Health, and the nurse came out to see her and said, "You're doing so well. You're in great health." And I was like, and that was the nurse that visits, to kind of catch the in between. And I literally just thought, this system is broken. There is
Right.
so many pieces. And I think you're right. It's just even giving not only the implicit bias, but giving all the care providers the ability to say something's not right, let's push this forward, or giving them the time to do it. And
Right.
for a myriad of reasons this happened, but I will say that COVID exposed a lot of it, and I'm hoping that it will there will be changes. But I will say I'm so grateful for the work that you are doing, and for the Healthcare Georgia Foundation, what's happening there, because I just really see the impact that you all are making in Georgia. And I just want to say continue the wonderful work. And I hope that that it spurs other funders in Georgia, as well as individuals to support their local communities. So thank you again for being a part of the podcast today, and and just being, just kind of, just being able to take that call and participate. It really means the world to me. So
Well,
thanks again, Lisa.
thank you for having me. It's been a pleasure, and for your work and your passion about this work, and using this platform and using your skills and resources to elevate this really important issue. So it's just been an honor for me to be here with you. Many blessings, and we definitely need to stay in touch.
Yeah.
And I'm just glad we were able to pull this off.
Wonderful. Thank you so much.